Today, we're digging into a medical case that threw an entire team of specialists for a loop. It's a story that uncovers a really surprising truth about a disease many of us thought was a thing of the past. This is the unusual case of Hansen's disease.
So it all starts when a 21-year-old man walks into a hospital in Portugal. He is not doing well at all. His symptoms are alarming, they're confusing, and for the medical team, the clock was already ticking to solve this puzzle.
All right, so here we are in the emergency room. For the doctors on duty, the race to figure out what was happening had just begun.
Okay, let's get into the details here. Look at this profile. He's a young construction worker, originally from Brazil, living in Portugal. He shows up with a high fever, chills, and severe joint pain. But the really alarming parts? These skin lesions with blisters and dead tissue, and a very specific neurological sign, a dropped left foot, which means he's losing muscle control. It's a mix of symptoms that, right off the bat, just doesn't make any sense.
And that's the million-dollar question on everyone's mind in that ER. What on earth could be causing such a complicated set of symptoms? A common infection? Some rare autoimmune disease? Every guest led them down a different path, and with the patient's condition, they needed answers fast.
So with such a confusing picture, the medical team kicks into high gear. It's a real race against time, where they have to test every possible theory to find out what's really going on.
Their diagnostic journey? Well, it started with a total dead end. 8 days of antibiotics did absolutely nothing. So next, they try corticosteroids. And something really unexpected happens. His symptoms actually get better. But here's the thing, that improvement? It was a dangerous false lead. The only real move left was the one that would change everything, performing a skin biopsy.
And you can just see how misleading this was. At the start, the lesions were severe, really inflamed. But after just 7 days on steroids, they looked dramatically better. This visual improvement pointed them toward wrong diagnoses, like something called sweet syndrome, all while the real infection was just being masked.
And this was the turning point. It became crystal clear that what they were seeing with their own eyes was an illusion. The real answer was hidden, down at the microscopic level.
So let's move on to the big reveal, the climax of this whole investigation. The answer everyone was searching for was about to pop up, not on a blood test or an X-ray, but in the report from that skin biopsy.
Presence of acid-fast bacilli. Now, to you and me, that might just sound like a bunch of medical jargon. But for that medical team, it was like someone flipped a giant light switch in a dark room. Acid-fast bacilli is the telltale signature of a very specific kind of bacteria. So here's the bottom line. The diagnosis was Hansen's disease, in its multibacillary form. You probably know it by its more common name, leprosy. It's a chronic infectious disease caused by the bacterium Mycobacterium leprae. Just like that, the mystery was solved. Now that we have the diagnosis, let's step back for a second and understand a little more about this condition. One that, let's be honest, most of us think only exists in history books.
Hansen's disease kind of has two different faces, and it all comes down to how your own immune system responds. In the tuberculoid form, your immune system puts up a really strong fight, so there aren't many bacteria. But in our patient's case, he had the lepromatous or multibacillary form. That's where the immune response is weak, which lets the bacteria multiply like crazy and cause all those severe symptoms we saw.
And this is exactly why this case is so relevant today. Hansen's disease is not some ancient relic. Brazil, where our patient was from, actually has one of the highest numbers of cases in the world. It's so important to know that it's not very contagious. It takes prolonged, close contact with an untreated person. And maybe the most important fact of all, there is an effective cure, and it's free.
So the medical journey to get the diagnosis was a huge success. But the hardest battle, so often, isn't against the bacteria. It's against something much, much older. Stigma.
This quote from the actual scientific paper really just says it all. The social stigma, the fear and misinformation tied to the very name leprosy, can be a massive barrier that stops someone from accepting their diagnosis and, crucially, sticking with the treatment. But here's where the story takes a truly tragic turn. Despite all the incredible work to get the right diagnosis, the patient was referred for follow-up care, and he never showed up. He just abandoned the process completely, without ever starting the therapy that could have cured him.
6 to 12 months.
That's it. That's the amount of time the full course of medication would have taken to cure him and prevent any permanent damage.
You know, this case perfectly showcases the power of medicine to solve these incredibly complex puzzles. But it also exposes a much, much bigger challenge. Science has given us the cure for the disease itself. But the question this leaves us with is, how do we cure the prejudice that stops people from seeking it? Thanks for joining us.